This audiobook is based on our book about a key philosophical principle in medicine, without which a true understanding of human health is impossible. We extend the previously formulated principle of disease optimality to human health and human life, not only at the individual, but also at the societal level. In this chapter, we are talking about society as a functional system. We treat the health of a community not as a mere statistical average, but as an independent property of the social system. It is defined by the system's capacity to sustain conditions in which individual life trajectories can be realized at the lowest possible systemic cost. If individual WellSpan is the qualitative duration of a personal life, then societal health is the SOSIS ability to minimize the adaptive price people pay for belonging to it. In this chapter, we examine how, through institutions of justice, culture, and strategic reforms, society can make crises cheaper and create an environment in which flourishing becomes the natural result of systemic coherence. Societal health is not the absence of conflict or complete equality, but a state of the SOSIS in which individuals can realize their potential at the lowest attainable adaptive cost. At the social level, the principle of optimality means the system's ability to minimize inevitable losses, disease, poverty, violence, and chronic social stress while preserving the highest feasible degree of freedom of choice for individuals. Here, maximal freedom is not anarchy, but an indicator that rules and institutions are organized optimally, such that people are not forced to pay with their own health for basic survival. In a healthy society, the WellSpan of the majority is not a byproduct, but a key criterion for evaluating any collective decision. A system that generates traps of poverty or instability, in which the adaptive price of life is predictably excessive, is pathological regardless of its economic indicators. At the level of the SOSIS, genuine prevention is implemented not primarily in hospitals, but in institutions that reduce the need for costly adaptations. High-quality education increases the transparency of the world for the individual, making internal models of the future anticipations more adequate and life decisions less destructive. Culture provides norms of mutual support in non-violent interaction, substantially lowering the background level of chronic stress in the community. Institutional justice, in turn, ensures protection from discrimination and transparency of rules, preventing the development of learned helplessness, which correlates directly with high mortality. Together, these institutions shape an environment in which fewer people reach critical points of decompensation, thereby rendering the entire social functional system more economical and resilient. The health of communities is determined not only by institutions, but also by the everyday ecology of life. Social rhythms, the alignment of work, learning, and rest with the biological clock reduce social jet lag, which erodes somatic and mental health. Low levels of violence and stable basic safety norms free the organism from constant vigilance that would otherwise turn life into a draining stress experiment. The physical environment, from clean air to accessible healthy food, determines how costly mere existence in a given place is for the body. The WellSpan of communities is thus a property of the environment. Some societies are structurally cheap in terms of adaptive price, others are pathologically expensive, regardless of the personal efforts of those who live there. From the perspective of the principle, any social reform should be evaluated by how it changes the cost of inevitable crises, epidemiological, economic, or political. Optimizing interventions do not promise the absence of shocks. Instead, they aim to lessen the impact on the most vulnerable groups, so that crises do not become episodes of mass loss of WellSpan. This implies shifting emphasis from late, inexpensive reactions to early, systemic, and cheaper measures, for example, investing in primary care rather than exclusively in high-tech hospitals. A healthy society organizes its rhythms and institutions so as to minimize unnecessary losses of function during ordinary life and inevitable challenges, without erasing the diversity of individual trajectories. A successful reform is one that makes the system more flexible and adaptation within it less energy-intensive for each citizen. We will be grateful for your likes and for sharing information about this audiobook with others.